I've been working as an audiologist at Cochlear Implant centres for 30 years, but I feel like I've really learned a lot tonight. So thank you so much, everybody. Next slide, please. So I feel like as a clinician, as an audiologist, and also I'm chair of the British Cochlear Implant Group, I feel like I just want to say we are listening to you. So I don't have a hearing loss. I mean, I do feel that perhaps all of us are on a hearing loss journey. Your hearing changes throughout your life. So I think it's really important that we don't so much think of patients and not patients, because we're all patients, we're all on the same journey. Some people obviously have cochlear implants at any age. So I started thinking about, next slide, thanks Kez, what do people and families with cochlear implants need? But so on to the next slide. So I've quite often shown this slide before, and this shows some of the things that cochlear implant clinicians will help patients with. So many aspects that patients may need help with, but in a way, it's not me that should be saying, what do people and families with cochlear implants need? So next slide. Of course, this is the answer. Ask people and families with cochlear implants what they need. So I think as a clinician, when I see a patient, it's all too easy for me to think, I have 1.5 hours with this patient. I want to do an audiogram. I want to check their electrodes. I want to adjust their tuning. I want to fit them with a radio aid. And this is before the patient has even walked in the room. So as a clinician, we often do have a task-oriented approach, as somebody mentioned at the beginning. And of course, this is not the right way to be approaching the appointment. It may be that those things would help the patient at that time. It may be those things are important, but it's not the right time for those things. So as chair of the British Cochlear Implant Group, we have about 21 cochlear implant centres in the UK, and we're often thinking about how to deliver cochlear implant services. So I think certainly in most centres, we really try to deliver these services as and where the patients need them. So ranging from perhaps a visit to the care home or a visit to the patient's own home, and at the other end of the scale, the patient doing some of the care for themselves. But in fact, person-centered care, I think, is not even just how and where we deliver the services. We also need to involve people and their families in designing the services, implementing the services, and also evaluating them. And as some of you have mentioned tonight, it's crucial that people using our services are the ones evaluating our services. It's meaningless for me to say, I think I'm a really person-centered audiologist. It's utterly meaningless, because that means I'm centered on myself. I need to ask people I'm seeing what I could do better. Next slide, please. So a couple of years ago, CIICA did a session about rehabilitation, and I think at that point, I like to think of it perhaps more as coaching. Next slide. And I remember we talked then about who is the coach for people who use implants and their families. So is it the clinician? Is it the patient? Is it family members? Is it other people who have a hearing loss? Next slide, please. So I think really in the going forward, I think I'd like to introduce CI clinicians as coaching partners rather than coaches. This is how we need to be. We need to be partnering with the patients rather than this kind of clinician-led process. So my new term for tonight is cochlear implant clinicians are coaching partners. So I'm going to stop there because I feel like I'm learning so much more from all of you than you're learning from me. So I want to hear more from you.